Welcome to Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. Together, we'll lift the lid on the complex worlds of neurology, neurosurgery, and everything in between, hearing fascinating tales of the incredible staff and services carried out in the hospital every day.
Hi.
Hello. I found you.
So I'm Susan Larkin. I'm a microbiology consultant here at the Walton Centre, but I also deliver microbiology services across the whole of Liverpool through Liverpool Clinical Laboratories.
And I know that you, day to day, are an incredibly busy person. Tell me about your day to day.
So day to day as a microbiologist is actually really quite interesting because we don't have set clinics or theatre lists like a lot of my other medical colleagues would have, or surgical colleagues. I never really know what the day might bring quite often, and it can range from doing things like clinical work, so experiencing a call from a concerned clinician about an infection. It can be doing an ITU ward round with our consultants downstairs in Horsley and looking at the sickest patients and which antibiotics they're on. I can switch and do some antimicrobial stewardship strategic work. So how does the trust deliver our strategic plan around how do we reduce the amount of antibiotics we're using or misusing? We also do infection prevention and control, which is obviously a really important part of our role, and work very closely with the nursing team here as well around that. We deliver clinics such as OPAT, so we give IV or oral antibiotic therapy in the community, but there are patients, so we very much have to look after them whilst they're on that course of treatment. We check in with them weekly, check their bloods, see how they're going, is the line working, etc. And therefore some of our really complex infections like brain or spine infections as well. I think it's fair to say that microbiology is quite unseen outside of the trust. Yeah. But when you start working with us, you realise actually how important we are to not just delivering care for the patients, but a lot of the things in the background as well about keeping the staff and the patients safe with regards to infection prevention control.
It feels very much like you're that unseen safety net for those patients. You know, the consultant can go, actually, this doesn't look right. I'm going to talk to Susan. And then you can come in and go, yeah, we need to do this, that and the other.
Yeah, and I think we link in with a lot of people who are doing that job in the background. And I have a great working relationship with the consultants here. The door's always open. We have really good, robust discussions about patients. We don't always 100% agree, but we always find the right way forward for the patients.
So why microbiology? What got you into it?
It's a few years ago now since I picked microbiology, and even longer since I was at med school. Really enjoyed lots of the different aspects of the jobs as a junior doctor. Thought at one point I might like obs and gynae, but then was fortunate enough as part of my rotations as a junior doctor to do a microbiology post in Sheffield, and just had the most inspirational people there, really.
Wow, really?
It was a field that I'd never thought about before, experienced, obviously had phoned them for advice many times, and it was just this wonderful kind of scientific world, I suppose. One of the big things I didn't really mention at the beginning is, we're responsible for the laboratory, the microbiology laboratory. My fantastic colleagues, our BMSs, our MLAs, are there working hard 24/7 to make sure that samples are, they're delivered on time, they're processed properly, and we get the results quickly for our patients, again, to help with our antimicrobial stewardship, getting people onto their antibiotics. And it was just this amazing world. I thought, I could really get into that. And it's not just the science, you are, as the doctor, delivering that to the patients at bedside as well.
Is there a specific moment in that placement that you had in Sheffield where you just stood back and thought, yeah, this is it?
I was there for 3-4 months, and I think it just built over that time. There was a great group of juniors and consultants, and they had a fantastic clinical working relationship with their colleagues out on the wards as well. Traditionally, microbiology was a bit of an ivory tower kind of specialty where people stayed in their offices, did their academic work, and there wasn't much interaction with the clinical side. I think now it's completely changed, which is to the benefit of everybody.
Where did you go to medical school? Where did you do your microbiology further studies?
So I moved around a little bit, but not lots. Went to the wonderful city of Sheffield for my medical school training. Got to stay there for 2 years afterwards. And that's where I experienced microbiology, as I've said. And then subsequently for training programmes and everything else, as doctors often have to move around quite a bit, I got into the training post in the West Midlands. But the West Midlands is absolutely massive. 3 years as well, so across Heartlands and the QE. And then finished up for my final year in Worcester. So it was a real mix of different trusts, hospitals, people, labs. It was a fantastic experience across the patch.
Do you find that moving around, whilst at the time can be really difficult, personally, professionally, do you think that's helped
There's pros and cons to, I think, staying in one place versus seeing and moving around a lot, as you've kind of alluded to there, I think, Sam. I think it benefited me. I think moving every year gives you a fresh pair of eyes coming into different settings, which have their own challenges. It builds in some resilience, I think, as well. And it just gives you the opportunity, I think, to link up with lots of different people, lots of different specialties, different trusts, different executive teams. Because as we said at the beginning, a microbiologist has to know everybody from the cleaners on the wards to the chief exec. And you've got to be able to work with everybody and find a way to communicate these important messages.
Where do your passions lie in all of it?
Probably unexpectedly with infection prevention control. I think when most people start out in their consultant career in microbiology, it's something that's a bit daunting. But it's a role that I've really grown into, and I've had to do some fantastic teams and team currently that I work with. We've delivered so many wonderful quality improvement projects that we've really seen and have benefited the patients of the Walton Centre. We obviously had that awful blip in the middle with COVID, but we steered a good ship, I think, and we did our very best to keep people safe. We had a different experience perhaps than other trusts because we don't have an A&E, but we were very much under pressure to keep cancer surgeries going and in a safe fashion as well, for these vulnerable patients.
Absolutely, and we had that overflow as well, didn't we? Like you said, we haven't got an A&E, but we were supporting the general hospitals around us because they needed to move patients around so we could, the hospital specialists around them could accommodate them. So that's a challenge in itself.
It was, and we flexed and we learned and we grew and became stronger as a team because of it, really. But I think with regards to infection prevention control, you never ever know what you're going to walk into each day, what potential disaster or massive win. And we have lots of targets and thresholds that we have to meet each year, and we work so hard to try and deliver on that, whilst also trying to be innovative and we have a data analyst now within the team, trying to use IT and data to show where we are and what we've improved upon, etc. Yeah,
that's really interesting. So you can see the numbers, and they really inform how you then look after patients going forward.
Yeah.
What are those challenges for you?
I think I'm really lucky that I work with the Walton Centre. The smallness of it allows everyone to know who everybody is and to actually move things forward in a probably quicker fashion than a bigger trust. It's always going to be the people, how many people you've got, how much resource, etc. With regards to stewardship in particular, so antimicrobial stewardship is an international concern. And myself and Sean Lofthouse, who's our antimicrobial pharmacist, and we also have an antimicrobial stewardship kind of committee as well, are really fantastic, committed, dedicated people, but there's probably not quite enough of us.
Right.
We have actually achieved in the last year GAMSAS level 3 accreditation, which is a global scheme, basically awarding us to say, you're doing wonderful work, but you're not quite at the outstanding stage yet.
Oh, I see. But you're on the scale sort of thing. They've said you're doing really well and you're headed in the right direction.
We are. And it was a real big kind of tick for us that we're doing all the right things. We've done a really good job at Walton, but really the next step is we might need some more people, some more help with that type of thing.
I suppose the challenge is the challenge, but that reassurance is quite positive, isn't it? It tells you that you're doing the right thing.
Yeah. I think most challenges, I like problem solving. You could say there's an issue when the laboratory was no longer on site at Aintree, which is over the road from here, and it went to the Royal. That's many years ago. But actually, we found ways to mitigate that risk. We found ways forward, communication, and our turnaround times actually for you guys are just as good as they ever were.
Yeah.
So we can often take a lot of those challenges and think, well, it might take time, and it might take a lot of talking to people, but actually you can find a way forward.
What would you say the most rewarding part of your job is?
Probably the people that I work with and actually seeing them come with me with my mad ideas. I've worked wonderfully with the wonderful hydrocephalus team here to reduce a particular type of infection. So we put drains in people's brains when there's a bit too much pressure, and we had a couple of infections. And really that team has taken some of my mad ideas, made them their own, and absolutely flourished and massively reduced the infection risks to patients at Walton. So I think that's probably, that's what I take a lot of satisfaction from.
So Susan, we're going to do the quick fire round. Are you ready?
Okay.
What would you be if you weren't a microbiologist?
Ooh, that's a good one. I think my kind of my plan would be to run a supper club, because I just love cooking. I love cooking all sorts of different types of food, and it would mean I could sit down and eat and meet all these amazing people.
What's your biggest hobby?
Probably cooking, but also netball. Absolutely love my netball. And wherever I've gone and found a team and friends and settled into that environment, because I'm only there for a year at a time when we were moving a lot, and have a wonderful team now called Hawks, who I have to give a shout out to.
Favourite song?
That would probably have to be something by Dolly Parton, because I just love her. Going to go for Harper Valley PTA.
Favourite book?
Don't know if I have a favourite book, but my guilty pleasure definitely has been over the last couple of years is the Richard Osman Thursday Murder Club.
You're not the first person to say that.
Brilliant. And I've quite enjoyed the Graham Norton ones as well.
Food you love?
Most food, as previously mentioned. But if I had to pick, probably kind of Eastern European, very, very into kind of salads, vegetables. Really like Yotam Ottolenghi.
Oh, yes.
As a chef. So kind of really inspired by him to try all sorts of different new vegetables, ways of cooking. Really nice.
Food you hate?
Celery.
Straight out the
100%.
bat. Didn't even think.
Absolutely.
What's wrong with it?
Food of
Peppery.
Everything. The flavour, the texture, it's pointless. I don't like it.
It's hard to use in different recipes.
Yeah.
What advice would you give to your younger self?
Probably have a bit more confidence in yourself early on. I think it definitely grows with time. But just believe in yourself.
What's the best thing to have happened to you so far?
Professionally, probably, landing here, being in Liverpool, being in my family, at home, just having great people around me, really. 2 lovely kids, husband, mum and dad nearby, family, and just some fantastic friends as well.
Oh, that is so sweet, Susan. Who's your hero?
My mum's awesome. I've been so lucky to be surrounded by some such amazing, strong, independent women. My mum is she's outstanding, yeah.
And finally, something very few people know about you.
Well, I really quite love Dolly Parton. I've seen her live a few times, and I've been to Dollywood in Tennessee.
Oh my God, is it good?
It was wonderful. It was the most amazing experience of our lives. We were the only British people there on the day. It was absolutely hilarious because all the Americans were like, why did you come here?
What? I would love to go.
It was wonderful. She's just iconic, isn't she? Yeah. And has been forever. And I think even more so since the pandemic, everyone's realising her book clubs and her vaccine money and everything else. She just stands for just fun, but also, again, strong, independent woman working and just living her dream. Absolutely.
So tell me about infection prevention at the Walton Centre.
Key things. Well, one is obviously if you're not sure, ask. The staff are really helpful and friendly. We have a fantastic team here who actually look after infection prevention and control, who are out and about in the wards all the time. We do absolutely everything we should do and more to keep patients safe whilst they're here. We're held to account, which I think is really important to know as well. So there are national, they used to be called targets, but they're called trajectories now, about what type of infections you shouldn't be having.
Yes, while you're staying at hospital,
exactly. And then monitored on a national level. And we've done really well this year, to be honest. We've come in under what we've done last year, which is what we should be trying to achieve year on year.
Yeah. Because obviously when people come into hospital, they're not automatically going to get an infection. It's just that maybe the chances are slightly raised.
We do lots of prevention work. It's not just controlling infection.
Got you.
So, for example, we make sure that if someone has a urinary catheter during their surgery, that it's removed as quickly as possible, because the longer it's in, the more likely it will be that it becomes infected.
Right.
We make sure that patients are well hydrated, so lots of fluids and drinks. And again, that will hopefully prevent infections of the urinary tract.
Right.
So we do lots of work like that. It's not a given that you're going to come in and have an infection, absolutely not.
No,
and that's why we're here to absolutely and utterly drive that down as much as possible.
Yeah, so it's all about that balance then, isn't it?
We really go above and beyond to reduce our risk to our patients of having an infection post-op. Anyone that has a surgery is always going to be counselled to say there is a risk. But we have so many things in place to reduce that down to zero as much as possible.
And that's why you're doing loads of rounds like you do today. You're on the way as well.
I do go around with the head of the team at least once a month to a ward, and we have a little nosy round, check up, say hi, see what issues people have. And we also do the same with our lovely estates team.
Oh, yes.
So that's really, really important, isn't it? We need things to be working properly. So we need showers to be draining properly, toilets to be flushing properly. Again, just to make sure that everyone's safe and things are appropriate.
Of course. I think that's something people don't think about as well, isn't it? Making sure that the fresh water that's coming through the pipes and stuff
is safe. In fact, we've got water safety committee this afternoon, Sam. You're very welcome.
So how has microbiology changed over the course of your career then?
So it's changed an awful lot in the, relatively short time that I've been doing it, which has been, 15 years. I suppose that's quite a long time, isn't it? But the technology is not recognisable even from when I started, let alone 5 or 10 years before that. I talked previously on this this forum about kind of, personalised care, individualised care. So the kind of the next stage really is looking at things called whole genome sequencing and beyond. You can take the bacteria and look at absolutely every element of it to say actually how should we target it, what resistance mechanisms are there, how will that patient react to this antibiotic. That's kind of next generation where we're going.
Wow.
But the technology is hugely changed. So the quicker we can get that result to the patient, to the ward, to the clinician, the better we can treat them. And then that comes back to antimicrobial stewardship again.
Yeah.
Because quite often we will have people on broad spectrum antibiotics in the hospital, which means it's going to target lots of your natural flora and bacteria. And by doing that, can actually encourage resistance in bacteria as well, which makes things more difficult to treat, but also then can spread to other patients within the trust.
Right.
So the quicker we can perhaps narrow that down to an antibiotic that's just going to target the bug that you have in your urine or your bloodstream or your head or your spine, then that's much better for the patient, but the population as a whole as well.
So like you said, that personal care right at the microbial level even is what you're trying to get, and it's where that's headed. That's incredible.
Yeah.
Because obviously you hear in the news, don't you, all the time about drug resistant bugs and different things like that. Is that similar to this? Is that what they're
exactly
talking
the same, Sam. So I'm really pleased that you've heard that you're aware of it, because it is a massive public health concern.
Yeah.
Locally, nationally, internationally. And part of the problem is we don't really have many antibiotics. We haven't had them for that long, just 100 years, some of them slightly over. But big pharma works in a way that they need to make money.
Yes.
So to develop a new drug, it costs $2 trillion or whatever it would be.
Amounts of money.
And of course, then it's on patent and they make money that way. And it makes sense, doesn't it? That's what drives things. However, if they go to the effort of making a new class of antibiotic, what's the first thing I'm going to say? Am I going to let everybody have this new wonderful drug? No, I'm not. No. I'm going to say that's top shelf. It's going to be reserved for this situation, minimal use, stewardship. Yeah. And it just shuts down any kind of research around it. So that's really the international concern and conversations that are going on, is to try and encourage people, one, use antibiotics appropriately, sensibly when you need to, narrow them down as quickly as possible with support from your microbiology lab, but we need big pharma and investment really in new antibiotics.
And is that something that you're excited about for the future? That being able to target this particular strain, that particular biology?
Absolutely. I think, as a microbiologist, you have to be passionate about the laboratory. It's such an important integral part of our job. And as I said, such fantastic colleagues that work in the micro labs at LCL. We just couldn't be without them, really. Yeah. What they do is so unbelievably important that most people don't have a clue what's happening behind those closed doors.
Do you think people really understand how microbiology fits in? Because you said at the beginning it was quite an unknown part of somebody's care.
I think probably, again, because of the way the Walton Centre is, it's not traditional nurse-doctor quite a lot of the time. You have so many healthcare professionals as part of the team. You've got your specialist nurses, you've got an absolute array of people, therapies, and I think the patients and the relatives understand that it's not just the doctor comes in and says this and the nurse does that anymore. The infections, again, at Walton are quite unique in so much as, yes, you get your normal kind of UTIs and pneumonias to some degree, but the reason I'm kind of specialist in this area is because we treat brain infections like abscesses and collections, and we do the same with the spine. So if you have those types of infections, you're going to be on antibiotics for maybe 6 weeks. So you're going
It's quite a long time, isn't it?
It's a really long time. So, you will be aware that, we discuss the patients every single week through our clinic, but also in our multidisciplinary ward round as well on a Tuesday, and the spinal MDT on a Monday. So those messages should be filtering through to the patients. I very much hope that they're aware that the antibiotics have been well thought out and considered. Yeah. And we are also moving from giving a lot of intravenous, so through a drip antibiotics now, to giving more oral therapy, because there's lots of benefits to that, mostly really around the fact that having a line in can create a risk of infection in itself.
Right.
And there's lots of evidence to say now that we don't need to keep the drip medicine up forever, and oral therapy is a really good positive outcome. So there's lots of things that have changed probably for patients over time.
Yeah.
You know, you've said yourself that you're aware that we need to protect these antibiotics, and microbiology is, you know, in existence. And we do also have the yearly antimicrobial awareness week in November.
Yeah.
So we try and engage with patients and staff at that point as well. Well over 60-70% of people coming through the front door of an A&E in a big trust like over the road will be prescribed antibiotics whilst they're in hospital. They're really, really precious, and we need to look after them. And it all has to link in together, doesn't it? We have to listen to the people looking after us. We have to send the right samples at the right time. We have to respond and react to those as well. But it has to link in with infection prevention and control. That's such an important part of this.
Thanks for listening to Neuro Stories. You can listen to more episodes on Spotify and Apple Podcasts, and you can stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.